And thanks again for joining our event today. My name is Sarah Nutter, and I'm a member of the Populations and Health Research Cluster and faculty member in the Counseling Psychology program. I'm pleased to welcome you to our session on Population Data BC provided by Gitta Oldendorf. Gitta Oldendorf is the Managing Director of Population Data BC. Prior to joining PopData 7 years ago, Gitta held senior positions at the Michael Smith Foundation for Health Research, the City of Vancouver, and ICBC. She holds a PhD in political science from the University of Hamburg, and outside of the office enjoys running and is a keen follower of soccer. Thanks so much for joining us, Gitta. I appreciate you being here today.
Oh, thank you so much for the lovely introduction. And I want to acknowledge, first of all, that I come to you from the traditional, ancestral, and unceded territory of the Musqueam people, which is where the UBC campus is situated. And I also want to acknowledge that I wasn't planning on being here, but my colleague, Joanne Curtin, who you might have seen on the program, unfortunately is ill and wasn't able to do this presentation today. That Joanne is our lead of what we call our data access unit. And highly competent, obviously, in all the details. And once you have, we get to the question part, there may be things that I have to defer, but I invite you to send me at any time, not just now, whatever questions you may have, and we'll deal with it. So that's sort of as a little preface. I also, as you may have heard, am an immigrant to Canada from Germany, and been here for a long time now. I lived in the north, so I have some very basic appreciation of the, I guess, diversity even within this province in terms of challenges around healthcare and the accessibility thereof. And you will see in my presentation or here some of the themes that I think were pretty obvious in Kim's presentation. And I think I hadn't listened to her in a while give this presentation, and what really struck me was her emphasis on people. And I can assure you every day at PopData, even though we're so process heavy, and it's easy to forget sometimes what we're actually dealing with. We do remember, and if I sometimes sound like a broken record when I say we're doing this because we're serving the people of British Columbia, and that's the researchers, and through that, every individual in this province. And what we do, while it is often quite removed from healthcare setting, obviously, is critical in improving the well-being of our population. So I can assure you that the team at PopData is very aware of the importance of what we're doing, and we share your frustrations quite often in terms of the speed with which things happen and so forth. So I'm not saying this to start this presentation with an excuse. I'm really telling you how I show up at work every day. And so the second piece, I think, that you will see in my presentation that Kim touched on quite a bit is I think what came through as principle 2 of the charter, and that's the harmonization of different processes. So you'll see that even within BC, there's not one way to get to data. And I deliberately say data, not health-related data, because we actually provide access to more than just strictly health-related data. And I personally have an appreciation for it because, as you've heard, my background is social sciences. And, as we progress in time, I think most of you know, and I know UVic has very strong, non-strictly health-related faculties that deal with health-related issues. It's increasingly unconscionable to think of health research in a broader sense without considering the social determinants or economic determinants of health. So that's becoming increasingly recognized in the way we provide access, but also in the way the types of data sets you can access. And the last principle that I picked up from her presentation is, and she said it very clearly, we can't do it alone. And that is really the broad, we can't do it alone in the sense of partnerships with various, I don't like the word, but for lack of a better term, stakeholders. So that goes anything from government to partner organizations, but also informal partnerships with all of you. I could name a bunch of examples where we try to push the limits and say, hey, you are really good at this AI work. We don't currently do this. Can we work together? Can we learn together? So we do that routinely. It's a strain sometimes on all of this, both for the researcher and for us, because there are never enough resources. You know that. So, but we're doing this because the other thing that I want to say just to preface this presentation is none of this is ever static or unambiguous. It's never black and white. It's always about trying to be in that space of uncertainty, yet trying to generate as much certainty for you as our customers so that you can plan. We're very aware that you need to plan, that you need to know as much as possible, because it's not just about the importance of the research, but also the employment you provide. You have analysts sitting around if we don't give you the certainty to the degree that we can as to how the process might unfold. So just so you know, whatever I'm going to say now is sort of held in that general context. Yeah, maybe we'll just start then with the slides. Whoever is driving it, I'm going to follow along. So I'm just going to minimize I can see all of you and not the screen. Here we go, much better. So this is, we've actually for years tried to work on a nice vision or mission statement, and it's in flux because things change and our governance is never 100% clear, but that would be a different presentation. So, but what we do is what you see right there. We're linking data for research and ultimately to inform the policy making and decision making for healthcare communities. And it's primarily BC because we're population data BC, and also, as you know, one of the nodes in the HDRN network. And what we do is not just determined by BC needs, but increasingly by a pan-Canadian perspective. And we can move to the next slide. So I'm not going into the details, but what I wanted to point out is we've got a long history, and it started in 1996 with the BC Linked Health Database. Many of you may be aware of the name Clyde Hertzman. He passed away and was one of the pioneers of creating the Human Early Learning Partnership, but also PopData, because in early childhood education and development, it's pretty obvious why you can't just look at health, but you need to look at the whole context, and you need to link data from various sources. So over that course of, you can see 20-something years, we grew, developed more resources, but also more different streams of access. And we can move on from here because it'll get more interesting when I go into the details. So to summarize what we do at Population Data BC, short PopData, is we provide access. So we manage the whole process for you. We link data sets, and we then provide secure data storage, but not just the storage, but within that storage space, we have all the tools that people need to do the research. And Kim also talked about data literacy and the need to continue to build capacity in that area. So we do have a component, education and training, and we're actually working very closely with UVic on the PhDA program, which has is a certificate program and supports people in learning how to use data. So very briefly, we could go to the next slide, please, and right to the next one. So we have currently two main streams of access for academic researchers. There's a third one, and that's the I'm just going to mention it up front. It's called the Health Data Platform and run by the Ministry of Health, the provincial government, and it's another collection that you can access through PopData. It's currently in the development still for academic access. Right now, it mainly serves the government connected health authorities and so forth, pardon me, researchers, but there is the intent to also provide access for academics. So I'm going to focus on these two right now because those are currently the main streams. We have what we call on the left side the traditional stream, and I summarized a little bit already. Who provides the data, where they stored, and they are secure research environment, and then you can link the data. And the legislation, I didn't mention that yet, under which all of this happens is the FIPPA, the Freedom of Information and Protection for Privacy Act. And we'll get into the data sets in detail that are available. About when did we provide access through the Data Innovation Program on the right side? Would have been about 2 years ago. And it's a completely different model. It's data access to data sets that are way beyond health. And the BC Stats Act provides access. We were involved in developing all of this. It was really quite fascinating to try to figure out how can we make this happen. So various BC ministries work with the Ministry of Citizen Services, through which the Data Innovation Program is delivered, and provide data to that and authority to that program to make it available through PopData. So we can go to the next slide. There's going to be a bit more detail there on, first of all, who we what all the data sets, the information the data sets contain. So we have 5.5 million residents roughly in BC, and it's fair to say that we hold data on everyone who's here, because if you're here, you most likely have a part of the medical services in BC. And so how much data we have on each person depends on their life experience and their contact with the system. So you will recognize some of the data sets, but we have data at the DAD, we have data on hospital stays, we have, I mentioned it earlier, education, early childhood education data, doctor's visits, medication prescribed, the vital stats. We have data from perinatal BC, pregnancy and childbirth, and so forth, and WorkSafe BC as well. We can go to the next slide. So if you are, you can see it here in the example, 26-year-old male, but you're not even a Canadian born person, but we have more information on you than somebody who retired to BC from Alberta, let's say. So it really depends on the contact with the system. And depending on that, we have records on you in the various data sets that we hold. So we can go to the next slide again. And so now I'll let you just digest this maybe on your own for a second. We have those data sets available through the traditional stream at PopData. Many of those are also available through the Data Innovation Program. And I'm going to go take you to the next slide now where you can see. Oh, no, back, one more, back. That looked the same, but it's not the same. No, it's tricking you. It is actually the one that shows the data sets available through the Data Innovation Program. So all of this is on our website. Like it's all there. Currently, we're just trying to make some improvements. You can't see this side to side, but you can actually punch in what you'd like to do and then see it that way. But at some point, we'll also have something up that allows you to compare just in one glance. Yeah, so you can see there's also quite a significant portion of non-traditional health data. And all of these are also linkable. So we will do that as well. So now we can go, I'm sure you'll have questions about it. We can go to the next slide. So I'm prepared to entertain those, obviously. So you saw BC Stats and FIPPA are the governing legislations or models, and but we also realized that it's not enough to just refer to legislation. There has to be something that helps us operate every day. And the 5 SAFEs model, I'd say, I don't know, it became popular about 5 years ago, and it's widely used in Canada, but also beyond. And it's basically saying we need to have in mind that those 5 principles as check boxes with whatever we do. So it's safe projects. We'll ask ourselves, is the use of the data appropriate? Safe people. So that also means we have training that goes with this. So we'll have to put in place various things that support those principles. And safe data. So you may ask for certain data related to abortions, and that might be a problem, and you can't. You'll have to go through extra steps. Safe settings. So that's pretty obvious, and then the outputs. You are familiar with that as well, I'm pretty sure. So you can see that all data access requests must meet the data provider's requirements for all of the 5 safe elements in order to be approved. And I'm going to describe to you in the next slide now the process for data access. We'll briefly go through those 7 stages, but what is important to know is that each of those stages is highly process driven, and also comes with a lot of rules and checks and balances, and at the same time is full of the ambiguities that I mentioned earlier. So, we're not ever going to say whatever is happening is black and white. We're going to try to make work for you what you need, and that allows us to push forward what we can do to promote research. So very briefly, we can go to the next slide. We are now in the data planning, access planning stage. So you'd come to us, and you heard it earlier, we'll look at feasibility and cost estimates. There's different tools that you can use yourself. We have the Data Scout, BC Data Scout. There's a link on our website where you can see what data sets are available and what will they likely give you the data that you need. So you can do a bit of it yourself, but mostly we'll help you with this. So the next one is, I'm just flipping through myself here to see. Yeah, so the DAR, you've heard that word potentially, it's the data access request. So, and we have a form online, and we help you at any time with filling it out if there are questions. But within the new DAR, it's new because we actually just put a revised version up. We support your ethics and peer review requirements, and consent forms, and the coordination of the DAR and pre-submission review, all of this is supported by us. And then we will submit the data access request or DAR on your behalf to the data steward or data stewards. I'm sure most of you possibly are familiar with the term data steward. It's the entity that holds responsibility for the data. So often it's the Ministry of Health, Perinatal Services of BC, I've mentioned those before, WorkSafe, it could be Immigration Canada, it could be some other entity that collected data that you don't hold, it could be you because you collected data. So stage 3, the data steward review, that is now depending on the data you have, it'll go faster or slower, because over at the data stewards, they have their own criteria for review, and they will do their best to do it quickly. But sometimes, especially if you use pharmaceutical data, PharmaNet data, the Data Stewardship Committee will have to get involved. It's a legislated committee that meets certain times per year. And it sometimes can be, and some of you may have experienced, it can be a little bit of a bottleneck. And but we are working with the ministry, and they've been fantastic in making changes so that things are going faster. So then once the review is done, the data access unit will notify the researcher, and now comes stage 4. And you can imagine, I have experienced it, none of this is possible without contracts. And we are then drafting up, again, on your behalf, a research agreement and a confidentiality pledge that you sign. And that regulates basically how you treat the data and what's possible and what's not possible. And then a services agreement and a cost quote are prepared, because you have to pay for our services. And that is done, again, it's on our website per data set, type of linkage you want to, the amount of linkages required, and so forth. And then we set up your accounts in our secure research environment, and everybody who's doing work in that environment will have to complete our privacy training. So we can go to the next page. So then once we have defined the exact study population and the data is being linked, so you don't have anything to do with the linkage, we do that. And then we're providing the data extract, and that's being placed on our secure research environment, where you can now, in stage 6, over to the researcher, do your, sorry, oh, is that the next one? Yeah, I guess. Yes, it is. Okay. I'm using Joanne's slides. Okay, I know it's perfectly fine to go there. I'm going to explain this a little bit more. It's a good place to do it. So the secure research environment is essentially a private cloud. And it's a private cloud that sits behind multiple security measures. And so physically, we have security, reinforced walls, bulletproof glass, like the whole thing, multiple ways to get into our facilities, several doors. So it's actually physically secured. And then what you see on this slide is the virtual security. And so you have access to that environment through two-factor authentication, and it's through a YubiKey. So it's what you have and what you know. It's a password, and a physical device that you actually need. And then whatever we do, I should mention that as well in terms of data linkage. It's kind of interesting. I think that's why I'm mentioning it here. It's not really something you need to know as a researcher, but our people who do the data linkage have no connection to the internet on those machines. So it's completely secluded. And so they have another computer if they need to communicate with other people, but the actual linkage is happening on a separate machine. And of course, all the virtual security is provided as well. I, as the managing director, have no access to the server room because everything's done on a need to know and need to do basis, and I don't need to be in there. If I want to talk to one of our colleagues who do data linkage, I can't just walk up. I have to say, hey, can we talk? So they shut down the screen. So we take this very, very seriously. And we have repeated privacy training, both through UBC and through our own privacy training, which is very, very strict. And so just want you to know that that's the part that you or anybody accessing data on their own, if it was possible, just couldn't replicate it. And it might have been okay 30 years ago to exchange things on who remembers floppy disks? But obviously right now, the standards have increased, and we are growing with it, but we're also pushing the boundaries on that to make it increasingly secure. So next slide. I think we're coming to the end of the process. And that is, so you do your work now, however long you need access for, and then we do the closure for you again. I think we didn't talk much about the pre-publication requirement review and all of this, so that was here. We also do that for you because that is something that is required. Anyway, so we can now keep going. Just looking myself here. Yes. So common challenges for researchers accessing data. So I referred to that already. It's a detail-oriented process, and it does take time. One of the things that is important is to define the research cohort correctly so that you actually know what do you want to do in selecting the relevant data and variables. And of course, I mentioned it earlier, analytical skills are required. We find, though, that increasingly, the level of knowledge around analytics is significantly improved from where it was 5 or 6 years ago. It's because data are obviously more of a tool in research than they used to be, which is what we want to see. Do we want to, we can also go back later on maybe to the different data sets, but what I want to mention here now is we have made some progress in the speed of access, but also the ease of access by working with the Ministry of Health primarily to provide data in a core, we call it core data sets, core access. So that's essentially a bundle of frequently required variables. Only about 2 or 3 years ago, you'd have to come to us and tell us exactly what you want to do, and there would be a lot of back and forth. What is happening now is that we very easily get access to core data, and it's most variables, some of them, and all years, so whatever you want. So that's basically it's not pre-approved, but it's considered, if you go back to those 5 principles, it's considered safe data. And therefore the whole approval process is much, much faster. That is also true for the Data Innovation Program. Both streams provide access to core data. If you need something like a postal code level that isn't part of the core data set, or let's say like you need pregnancy terminations or other sensitive data that are not included in the core data set, then we will work with you. It will likely mean that it takes longer to get access to the data because there's more back and forth. But we don't have enough metrics. Well, we have the metrics, but we don't have enough data yet on those to tell you like how much faster it's going right now, but it's noticeable. and we have fewer bottlenecks. So it's made a huge difference. And we can't say enough about the Ministry of Health in working with us on that, and of course the Data Innovation Program as well. For them, it was a bit easier, to be honest, to conceptualize core data sets, because they started from scratch for health, and the sensitivity of the data and the history that came with it. It just made it a lot harder to change something that we were doing in a certain way for so many years, as opposed to starting something from scratch. But it's essentially how you would access data right now. Let's go to the next slide. And so Tim Choi pulled this together for us while Joanne is sick, and said we really should talk about what are common pitfalls if you want to access data. And so basically consult a statistician early, make sure that what you want to do is actually doable. And the next related step would be to create a detailed plan, and then use our in-house tools. I mentioned that already. We have tools, the Data Prospector, the Data Scout. Those are all tools you can look on our website that help you figure out what data do we have available, what does the metadata look like, and how difficult is it potentially to do what you want to do in terms of the research project that you have in mind. We are happy to help you with all of this. And you might find also on our website, research projects where people have used similar data before, and you can get some input on that. And I just noticed, okay, I didn't actually know this. Population, we have set up a chat, Mattermost chat. That's a Slack tool. Basically, it's a chat tool to which you have access, that allows researchers to collaborate and discuss research projects. That was news to me. But again, come to me at some point if you are at this stage, and I'll connect you with the appropriate people in the data access unit who can tap into all of this. I want to talk about, as a last sort of little bit the research difference that the difference the research makes. So if you go to the last slide, that would be good. We have it's also we send emails about the research that we support. We also have those stories on our website, and I think I started out talking about how seriously we take this, and how we know we keep in mind every day how important it is to support you in the research that you do, because it really does make a difference in everyone's life, we hope. And you can see some examples of the studies. Those are primarily, when I look at them, health related. We've also kind of interesting supported through the Data Innovation Program. That was still a pilot project at the time. You will have heard about the guaranteed basic income work that was done in BC. So we were involved in that. We supported that work. So completely out of the health realm, obviously. It was led by the Vancouver School of Economics here at UBC. So we do work, not just, it's really important to mention, obviously with UBC, we're a provincial resource. So we have these close connections with UBC through through various studies, but also through our education and training program. And we have numerous connections with SFU. We have reached out, and whenever we do consultation, we try to work with the other universities as well. There aren't that many projects at this point. It's largely large universities. And I think that has to do potentially with funding as well, because it does cost to access data. I'd like to point out that we've been involved very strongly with a number of the current health challenges. We were instrumental, I think, we were instrumental in working with the provincial health officer on the provincial overdose cohort, which is a pre-linked data set of some of the very sensitive data sets. And so it's pre-linked. Access is currently available only through competition. We hope that at some point it'll be accessible through request. And we've been involved throughout the pandemic. Our team worked incredibly hard to fast track access to data that will help us understand any various COVID-related policy questions. So in terms of vaccinations and hospitalizations and so forth. So I skipped over so much. There's so much more to say. So I think we have about 10 minutes for questions. Happy to entertain whatever comes to mind. And as I said, this is only the beginning of the conversation. We really want to work with you. So spread the word and contact me at any time.